Hello, this is Lynn Lucas-Fehm, President of the Pennsylvania Medical Society, and I'm here to do another podcast with one of our wonderful PAMED physicians. Uh, I have with me Dr. Timothy Flynn, a pediatrician. Let me tell you a little bit about his background. Dr. Flynn graduated from the University of Pennsylvania in 2006 and completed his graduate degree with an MS at Temple and completed medical school at Temple. Dr. Flynn served in the Army from 2008 to 2019, and we thank him for his service. He completed his residency at the Walter Reed National Military Medical Center, and then led a full service general pediatrics department in Fort Sill, Oklahoma. Since returning to Philadelphia in 2019, he has worked as an independent pediatric primary care physician, first as an employee and now as a partner. Dr. Flynn spends his free time reading, running, and enjoying activities with his family. So Dr. Flynn, welcome, and thank you for doing this.
Thank you for the introduction. It's great to be here with you today.
So I think we'll get started. I think people who've seen any part of my initiative know that I'm very interested in getting the viewpoints of different PAMED members, both to share their experiences and to educate, particularly some of our younger physicians who are trying to figure out what they're going to do. What are they going to be in? Are they going to be employed? Are they going to be independent? Large health system, small health system? And I'm just looking for our more experienced members to try and help show the way of what to do. So with that in mind, let me just start by asking you, Dr. Flynn, could you describe your current practice and the modality in which you work? And what do you think are the defining characteristics of the practice model you follow?
Sure thing. Thank you for the questions. So I'm an independent private practice primary care pediatrician, outpatient pediatrics only. It's a small practice. It's myself and one other physician as the owners. It's almost entirely clinical. We do have some administrative work that we have to do as owners of a small business, just like owners of any small business would do, but we don't get the cool administrative titles that you might get if you're part of a larger organization. Sometimes we have students and sometimes we don't have students, and we don't do any research. So mostly we spend our time practicing clinical medicine, and then we spend a fair fraction of our time doing administration for the practice, like any small business. In terms of the defining characteristics of the practice or our practice model, I would say it's independent and small. So there's nobody telling us what to do, but there's also nobody who's helping us out. So if there's something that we decide needs to get done, we have to do it. There's no other larger organization that's going to come in and help us do it, but there's also no bigger organization that's going to tell us you have to do this or you have to do that.
Well, that can certainly be an advantage in some way and then make it harder in others. How do you think that your practice model positively impacts patient care and patient outcomes? Do you think there's something particular about how you're doing things that's better for patient care?
Well, we're very proud of the care that we give. I think because we're small and independent, it allows us to be very nimble. So if we decide tomorrow that we want to change the way patients are scheduled, myself and the other owner have a conversation, and then later that day or the next day, the change is made. In terms of patient outcomes, I'll share a story that I'm very proud of, and it's not unique to our practice. When the COVID vaccine came out for children, we started giving it to them in the context of their regular medical visits at our practice. So people would come in, and if they wanted to get the COVID vaccine for their children, they could do it at our office during regular hours when their child was going to be seen anyway. And this was not unique to us. I know of other similarly situated independent pediatric practices that did the same thing. And we thought it was important. And I won't name names, but I know of two large healthcare organizations that if you wanted to get your child the COVID vaccine there, you had to leave from where their medical care was given in terms of the doctor's appointment, and you had to go to a different building to get the COVID vaccine. And I think that that's probably layers of bureaucracy that led to that kind of a setup happening. So we were able to give the COVID vaccine in the office and I think we reduced the amount of barriers that were there. We're really, really proud of that. So in terms of a concrete example of healthcare outcomes, I would say that's one that, and it wasn't just our practice, it was other practices that were similar to us. Were able to make the same thing happen, whereas multiple large organizations that I'm aware of couldn't figure out how to make it happen or didn't think it was important. In terms of challenges, not being part of a larger organization can make communication a little bit more difficult. If our patients are getting care at another organization where they're getting testing done there, and we're not on their EMR, it can just make communication a little bit more difficult. Whereas if you're part of a bigger organization, I think there's a better chance that all your patients are getting some, most, or all of their care within that organization, and probably the communication is going to be better.
If you could tell a starting out version of yourself, so give that person, that other doctor, some advice, what do you know now that you wish you had known then?
I think when I first started, I didn't realize how important customer service was in terms of the practice of medicine. It's a little bit more obvious to me now, being in an independent practice, very close to patients who are happy and unhappy, and compliments and complaints, and knowing that if patients don't value the care I give and the care that my coworkers and employees give, that they're not going to come back and see us again, and we'll eventually go out of business and be out of jobs. Whereas there's certain things in medicine that I think you have to do a certain way, or you really should do a certain way. And for other things, I think there's wiggle room on, and if patients want it done a different way, even if it wasn't the way I would do it, I think if it's ethical, that we should try to serve patients and meet them where they are. So it's taken me several years to realize that. I think part of it is maturity, and part of it is the practice environment that I'm in right now.
Do you see your particular model? I mean, there are so many huge health systems gobbling up smaller practices, smaller health systems. Do you foresee the future of your practice model as growing, in a sense, independent practitioners making more of a comeback?
I don't have a crystal ball, so it's very hard for me to predict. I do, in a global sense, when I look at it, it seems like there are fewer and fewer independent practices. That said, I know a lot of people who have been part of a larger organization and later in their career decide that they want to join an independent, that they want to either join an independent practice or start their own independent practice because they think that they can do it themselves. So I think for the foreseeable future, there's going to be a role for independent practices in many or all specialties, certainly in primary care pediatrics. Whether that increases or not, that's hard for me to say, and I would hate to predict and be wrong.
Yeah. Do you think there's anything in particular that makes it economically very difficult to start an independent practice?
In terms of that, so I was at the right place at the right time when I joined this practice. It already existed. So there's already a framework there's insurance contracts in place, there's a patient base in place, there's a reputation in the community, and all those things were very favorable. And there was room for someone who wanted to come in and who was committed to keeping the practice going. So I really have benefited from that in terms of my experience as an independent primary care pediatrician. I think the beginning would be the toughest part in terms of establishing insurance contracts and being slow for the first 6 months or 2 years. I think that would be the most challenging part of it.
Is there anything in particular that you think our fellow physicians should know that can provide them some guidance? And I point this more towards the younger physicians who are trying to figure out what they're going to do when they come out of their training. Do they just, go in like the majority, sign a contract, work as an employee, But for those that want to do something different, is there anything that you could tell them to help them figure it all out, whether they should try and do what you have done so successfully?
So I'll say a few things. So the one thing is working as a pediatrician for the Army. I was part of maybe it might be the largest healthcare organization in the United States. And now I'm doing something that's very different, much smaller. My current job, I thought it was going to be great, and it's actually been so much better than I thought it was going to be. It's really been incredible to be independent and to be so closely associated with each aspect of the business in terms of, does it succeed or does it fail? Does this thing work out, or do we need to try something different? It's also so much easier to go to work every day knowing that the decisions that we make in terms of who's working with us, what vendors are we using, who's the answering service, what does the call schedule look like, it's all so much more palatable when you have a vote. If you're not the deciding person, you at least have a significant vote. I think it's much more difficult when your boss comes in and says, this is the new call schedule, or this is the new answering service, this is how it is. When you don't get a vote, it can make it feel like you're not valued as a person or as a worker. The other thing that I would say is that medicine's awesome. It's a calling, it's a profession. I'm so happy to be doing this. It's also a job. And so when you're picking your job, whether it's an independent practice or you're working for somebody else, or you're working for multiple other people, I think you need to balance your profession with your personal life. And even though your job is a profession, you need to think about all the pieces of scheduling and work-life balance. As an independent physician, I've been able to balance that much better as a physician owner. And so I think that's part of why I like what I do so much. And the other thing I would say to physicians who are coming out of practice or starting a new job is that a sign-on bonus is usually, it's there to suck you in. It's there to get you there, and hopefully you plant roots wherever the person who gave you that sign-on bonus is, and then you're much less likely to leave. So I think the sign-on bonus when you're joining an organization or getting a job for the first time, it can look like a lot of money, but over your career, it's really not a whole lot of money. So you really should, I'm not saying you shouldn't take the sign-on bonus, but you should really round that down in terms of what you think is important. Look at your career longevity, look at what the overall compensation 5, 10, 15, 25 years out is going to be like.
Wonderful. And in fact, that last question, I think you really gave some incredible advice for people starting out. So that is great.
So another challenge that's facing independent practices right now is not-for-profit tax status and whether you have it or not. So most, maybe all independent practices don't have a not-for-profit tax status, and larger organizations that are not-for-profit and have that tax status, people that work there get public student loan forgiveness potentially. And so I think that's causing some problems in recruiting for independent practices. If you're coming out of training and you have a significant amount of debt that's eligible for public service loan forgiveness, you'd be silly not to think about the implications of working for a not-for-profit group versus a not-for-profit group. And so that's, although that is not impacting our practice right now, I think that it's a big issue in terms of recruiting physicians to independent practices.
I did not know that. Thank you.